health. And most importantly, I would underline the sentence that no woman will lose her breast because of cancer. Maybe you don't know that, but breast cancer is the leading cause of all women cancers. 1 in 8 women will get breast cancers, unfortunately. And this is not related with someone in your family having breast cancer. If you go past through the crowds and count the women that you encounter, unfortunately 1 in 8 women will get breast cancer. So because of this high ratio, we advise all women to be checked, to be controlled regularly, periodically. This is very important for early diagnosis and early treatment, because if we catch the cancer, if we diagnose the cancer, breast cancer early, the success rate of our treatment reaches up to 95%. However, if the diagnosis is late, unfortunately, this rate decreases to 50%. Success rate decreases to 50%. In advanced stages, such as stage 4, the 5-year survival rate is below 50%. So please, for all of us, for all of the ones that we love, you should be messengers, you should be ambassadors of this real problem, real public health problem. So what do we do for breast cancer screening? First of all, every woman has to learn to examine herself, and that should start at about 18 years of age. You can learn that from internet. However, I advise that you first go to a doctor, a breast health doctor. In Turkey, this is general surgeons, and in general surgeons also, throughout the general surgeons, only a ratio, a small percent of the doctors are really interested and specialized in breast diseases. So the first examination should be with doctor about 18 years of age, at most 20 years of age, and annually or biannually you should go to a doctor. And please, again, being ambassadors, as you're watching this live stream, that you please force your relatives, friends, the ones that you love, women, to go to doctor regularly, a breast surgeon regularly. Please do so. So, and I want to tell you about mammography screening. Mammography screening starts with the age of 40 in our country and globally, and depending on the country and depending on the condition of the patient, after the age of 40, but please don't forget to come to visit the doctor annually anyways after age of 20. And when this is going on after age of 40, you should go screening for the mammography annually or biannually, and this screening process will be done as far as 70 years of age. I tell my women patients that come to me, that do you have a car, or do you have any electronic equipment, or climate changers, machines in your home? Do you do regular checkups for those machines, cars, annually? So they say, all of them say that yes, we do that. However, unfortunately, when I ask them, do you go to annual examinations, physical examinations for your breast, most of them say no, because they say that they don't feel any lumps, any abnormalities, any asymmetry, so they don't feel to go to a doctor for that. So your machines are not important than your body. So please follow your doctor's orders and go to annual examinations. One other thing that I want to tell you about that is that biopsy does not result in any cancer. There's a misbelief, an urban legend here in Turkey, and when I do these live streams to, I believe, Jordan about 2 weeks ago, I told this problem in our country that people believe that when we do biopsy for a lesion in your body, they think that it'll change to, by doing biopsy, the lesion will change to a cancer. Now that's actually ridiculous. That's an urban legend. We do not have any power to change a lesion to cancer by just doing a biopsy. If we had this power, then vice versa should be true also, that we would have the power to change the malignant cancer lesions to a good benign lesion. So biopsy does not result in cancer. Okay, so let's say that you have diagnosed, or a relative of you is diagnosed, a friend of yours is diagnosed with breast cancer. If such a patient would be here about 15 years ago, the only solution, the only operation that we do at that time is mastectomy. Mastectomy means taking the breast and the axillary tissue all out in one operation. But nowadays that's not true. Due to technological improvements and due to the patient desires, and because of the results that we've taken from the literature, now that no woman today has to lose her breast because of breast cancer, although this is a widespread disease. For example, about 50%, half of the patients that come to me, we can do breast conserving surgery. That means we do not take the whole breast out, but the tissue, affected tissue and the healthy tissue around it, and the breast is preserved. The other half of the patients, unfortunately, will need to clean the breast tissue, all of it. For example, who are those women that we can do breast conserving surgery? This is a breast, as you can see. If the tumor is small, related with the breast volume, and it's single, we can take this part out, and so the breast is preserved. However, if the disease, let me tell you, and if we do a lumpectomy such as this, don't worry, by oncoplastic principles, you won't feel any cosmetic differences. We do oncoplastic surgery to preserve your breast mount and to preserve the fullness of the breast, such as rotation flaps or just breast moving surgery. We can do that. However, if the cancer is multifocal, that means the tumor, can you see it? Yeah, that means if the tumor is in many parts of the breast, so you cannot actually do this surgery, but we have to take the whole breast tissue out, because even if there are lumps here, 4 or 5, we cannot be sure that there are microscopic deposits in the other parts of the breast. And one other reason that we cannot preserve the breast is that if the tumor is located underneath the nipple, we do not like to do breast conserving surgery, breast preserving surgery at this part of tumor, because there are milk channels all over the breast going through the nipple, and think of it as a central station. If there's tumor here, by these channels the tumor may spread to other parts of the breast. So we do not like to preserve the breast when the tumor is underneath the nipple, that colored part. And this happens in about 50% of the patients. However, in even those 50%, no woman has to lose her breast, because at the same session we can do reconstructive surgery. Mostly we do that, I do perform that by removing the breast tissue here, mostly preserving the nipple, maybe not the nipple, but we can place a silicone prosthesis at the same session. That's possible. About 5 years ago, there were expanders that we use, that we remove the breast, nipple, and we placed expanders. Yeah, okay. There was a phone call, I'm sorry. And by expanding the tissue, skin tissue, over time, about 6 months, 1 year, then we took out the expander and placed the stationary prosthesis. But nowadays I do not perform, and authorities around the world also do not advise that, but we do that in just one session. Do the cancer surgery, what's necessary to be done, and it's our first priority, and then place the silicone prosthesis at the same session. And the results are very good, actually 95% successful at that. We are at that 95% successful. Let me tell you my experience on that. For the last 4-5 years, I have done such operations, such as removing the breast tissue and placing the stationary silicone prosthesis for about over 400 patients. So it's possible, and it's very successful. The patient, the woman, is happy with her new breast, and we do not endanger the patient about the oncological principles also. So, what about our time? Well, it's been about 15 minutes. Do you have any questions? I'm waiting for your questions now. No questions? Okay. So let me tell you about one other thing. Here in Turkey, even in Istanbul, I'm seeing patients such as that doctor